Hello guys, welcome to our channel. I have a great patient here from
Denmark?
First of all, Erkan, how are you?
I'm fine, thank you.
So you are done now with your lengthening, right?
I'm all done.
Okay, so just to know about your story a little bit. What was your height before the lengthening? What is your current height?
Before lengthening, I was almost 170,
Okay.
and now I should be 177,
You reach approximately 7.5.
7.5, yeah. So it should be 177.
Which method you choose?
I choose Precice.
Precise on your femur?
On my femur, yes,
Okay.
Precice.
So why precise?
Actually, before I came, I thought about Lon method, but when I spoke with you,
Yeah.
I thought Precice would be much better for me because I like to. It's more comfortable with Precice. I heard about it, and I can lay on my. I also love to lay on my stomach too, and it's more comfortable. I choose Precice, and I heard about the pain is also maybe less in compared to
The comfort is higher than the long. That's the reason why you feel automatically
yeah,
also
yeah.
good. But my question to you now, I mean, you did already the precise, you reached your goal and everything, but was really the case also because you meet also long patients here, right?
Yeah.
I mean, would you say that you had with precise really benefits?
You know, I think also good, but the Precice, I don't know if it's only for me, but really I must say that from the beginning to the end, I didn't have any pain with Precice. Only the first week.
Okay.
It's normal. At the hospital, I had some discomfort there and pain. The first 3 days, a little pain. But I didn't take almost any painkillers
Wow.
until I reached my goal.
Wow. I mean, this is now like, well, so look, I have to, we have to clarify one thing here. I mean, yes, that's true that we have really patient like Erkan because some patients also, there was also other patients maybe, I don't know, you know better than me because you are always in contact with them. So they don't have really pain and they never use painkiller or just a little bit of painkillers. So then we have patients who have really pain and like who suffer from the uncomfort, you know. But I mean, this is not like, please do not think like, okay, great, the surgery is like not painful, let's do it. I mean, it's not like that. Yes, Erkan.
I was just lucky.
Exactly.
Maybe.
Yeah, lucky. And also, by the way, Erkan, I have to say something. You are a person that you never was lazy, right?
No. I was at the gym every day, sometimes 3 times a day. At least 1-2 times, most of the day, 3 times at the gym.
And how was the feeling right after the gym?
It was very good, actually.
Yeah, that's the thing. I mean, we have then patients, you know what I'm talking about. Just they lay down in a room and they don't
Oh,
want
I
to come.
can't do that. I can't do that.
Yeah.
It's not me.
Yeah. That's the reason why they have pain, you know what I
Yeah.
mean?
I go bicycle, sometimes the walking pad. I use the walking pad sometimes. I just lift me a little bit, then I use the walking pad. But that I did after I did my nail exchange with the walking pad, not while I had my Precice.
I mean, there's some surgeons in different countries, they say lawn is risky and life risk and never do it. And you saw a lot of patients also with the lawn.
As I told you, I thought I would choose lawn before I came. But when I saw the other patients here, I think it's almost the same actually, but it's only that they just lay on their behind,
Back,
you know. Yeah.
Because of the fixator.
Yeah, and some of them has some pin pains. I saw that, but some of them. So maybe the pin pain, if you consider of that, then it's maybe a little bit. You know, if Precice is here, then Lon is maybe here. It's not like this. The difference, I think.
I mean, the way is the same. I mean, you know, you want to get tall, it doesn't matter. Lawn do the same job, precise same. Just the precise is without fixator, which means it's really comfortable.
Yeah.
But I did 3 times long, you did the precise. Yeah, I can imagine that the precise is really comfortable,
Yeah,
you know.
and also, you know, I could take shower every day.
That's the thing, you know.
That
And
means
even
a
this
lot.
give you
Yeah, that means a lot. I could take shower every day, you know. That means a lot. Sometimes I was like showering 1 hour like this after
and you
gym.
feel good,
After
right?
gym, yeah, it felt good. For lengthening, I took a hot shower, and also for my muscles, it was good for my muscles to warm the muscles up. Then I lengthening after that. It was also very nice.
You reach how much centimeter?
7.5.
Was it also your goal or?
My goal was actually everything over 5.
Oh, okay, great. I mean,
Everything
you
over
reach
5.
your goal, right?
Yeah,
You are
I
happy.
reached, yeah. Everything over 5, it was my goal, yeah.
Erkan, when was your start, like the first surgery? Which month?
It was January, the 8th of January.
2025.
Yeah.
And now we have the first
Eight.
week of April.
Yeah,
You are done with the lengthening.
yeah,
So now I want to talk about one topic. We had a problem with you, right?
yeah.
So you had
yeah,
some issue with the nail.
Yeah.
So can you explain a little bit what was our solution?
I don't know how it happened, but my precise nail was broken. It could still lengthening. So it wasn't like, you know, it was a big problem or something. It was just broken, but I could still lengthening. But I don't know how it happened. Maybe I was too much active, maybe.
No, I mean also I know that I knew that you never give weight bearing, right?
No.
Never. I mean because we told you Precice is not weight bearing.
And rotation,
Exactly.
I didn't do rotation.
But Erkan, you know, most probably such a damage. I mean, by the way, guys, when he say broken, it was not like broken like that.
Yeah, yeah,
I mean, just to clarify,
Yeah.
like some mechanical fault can happen. Like such a problems can most probably happen because of rotation or other things. But anyway, we told you you can lengthen, no problem. But once you finish, we recommend you the nail replacement, right? So, and we did the nail replacement when?
1.5.
How do you feel right now after the nail replacement?
Now perfect. Now I have long nails inside my femur, and it's full weight bearing. So it feels very comfortable. Now I can stand without thinking
Yeah.
of, you know,
Yeah.
if it's gonna break or something.
That's the point, you know. I mean, look, I mean, we always, as you know, so like, of course, we are doing surgery, problems can happen. We are not looking for problems or for faults. But the most important thing is to react right after and to have solutions. But the solution should be really logical, you know what I mean? Because not to handle emotionally or what to do, just cool, you know, and use the right cards, you know what I mean? And after that, so we let you lengthen because we saw, okay, it's not something serious, but this is something which we have to change it once you reach your goal. And yeah, and I'm really happy that you are right now here and ready to fly tomorrow back, you know.
Tomorrow, yeah.
Erkan, you reach 7.5 centimeter. Erkan, you are 44. Why you been go through the procedure? So why you decided for go to limblengthening surgery? Why you don't invest your money for other things? Can you
Buy a
clarify?
house or something.
Yeah, or car, or expensive car, whatever.
I feel 20. And I mean,
That's the most important thing.
yeah, I mean it. I feel 20. I will maybe live until I'm 90. Who knows that? So I still have maybe 45 years in front of me. 45 years maybe in front of me. And actually, reason why I did it, there's a couple of things, you know. Your life will be much easier when you are taller. Everybody knows that. And also because I have a son, and I thought maybe one time he will be maybe about 180 or something. I'm like his friend, you know, my son's. I'm like his friend. And then I thought in the future, maybe when I go out with him, it's not a big deal if I was 170 and he's 180. It's not that. But I think if we are more equal heights, then we'll be more like friends when we go out and play something, when we go out, you know. It's better for me also, and also for him, that we are almost equal, you know. And so I also thought about that when I go out with my family or something. I'm a little bit taller, you know, instead of maybe I have a daughter also, that my daughter will be taller than me maybe. Maybe she will still, but now we are more equal, I think.
And that gives you like more confident,
Yeah,
more happiness.
you will feel more confident when you go out and on holidays. When you go on holiday, you know, hotels, the pools. When you are at the pools with your family, all that kind of stuff. You know.
Wow, wow. I mean, it's like a different story, which makes me also happy. As I understand from your explanation, you are a good dad.
Yeah,
So,
thank you.
I mean,
Thank you.
your son should be really happy
Thank you.
to have such a dad. It's great. Okay, I mean, of course, it's a process. Now you need also time for recovery. But the most important thing, Erkan, is like you should be really say, hey, I'm happy. Is it the case?
Of course,
Great.
100%, 100%. If there was a little, you know, it's like I'm not, I'm telling the truth now. Whole process was perfect.
Wow.
I didn't experience something, you know, that bothered me or irritates me or something. Whole process.
What do you think about, like complication topic? I know nobody's talking about it. Also, none of the clinics or doctors in the world because they keep it as a secret. But I mean, I love to talk also honestly about this. So, and we of course have also complications. But you never been worried about that, or you thought about it, or what do you think now and before about complications?
No, because I always thought about, I play football every day, almost every day, train football. And I always thought about, I was lucky, I never broke my leg when I play football. But I saw it so many times from my own team. Some of them broke their legs. And also when you watch Barcelona, Real Madrid, for example, in the television, you see sometimes football players broke their legs. And they continue playing football after maybe 6 months.
Of course.
To break your bones, it's not a big deal, I think. It will always, you get new bones again. So when I thought professional football player, after 1 year they can play again, then why?
Why not limblengthening?
Yeah, and this is, controlled bone. It's not like when you break your bone when you play a game, It's much easier here. It's you just cut it straight,
Under the surgical control.
Yeah, controlled bone breaking.
I mean, here's the most important thing that the surgeon, yes, to broke the bone is okay, but to not damage the soft tissue, like which is then hard to fix it back. So like nerves or any soft tissues. But thanks God, it's not our goal or our vision to damage some soft tissues. I mean, we had a great surgery. So, by the way, Erkan's lengthening was great. So, no pain, it's also great. Yeah. And his x-ray is also great. Bone healing is great. Result is great. We don't have any sign of infection or inflammation, which also can happen for sure. Because at the end of the day, like surgery is infection risk, because we are going from outside to inside your body and we increase automatically, if you want or not, the infection risk. But have a really good immune system, so they can fight it with infections. It's the COVID, I mean, why people suffer or pass away because of COVID? Because people with no immune system or not strong enough happen the bad things. But people with a good, strong immune system, which we needed, you can easily protect your body self.
Yeah, of course.
It's wrong to ask this, but from your perspective, would you recommend the limblengthening surgery to other people's? If yes, if no, okay, but if yes, why you would recommend the limblengthening surgery to other people's?
Have a goal that you want to be taller, then go for it, I think, because it's not that bad. Now I have been here for 3 months, and I think actually the whole process was easy. I don't think it was difficult. And I told everyone that when I call home, sometimes they ask me, I always said, it's so easy. When I call home, I always said, it isn't difficult for me. It's not tough, As I told you before, I didn't take painkillers. I just, relax. And if you have a goal like that, then do it for your own, It's not that difficult.
You would never thought maybe the procedure is so easy?
Before I did it, I thought it would be more difficult.
Okay.
Actually, before I did it. But maybe for me like this, it's difficult.
Wow.
Yeah.
I mean, I'm happy for you. For me, it was really hard procedure.
For
Erkan,
you?
3 times. I mean, it was really hard. Especially mentally was for me hard. But if you say it was easy for me, respect. I mean, as you can see easily, everybody's different. You choose us for your journey. You trust your legs and your body and your health. I really appreciate it. So what is the reason why you trust us, and what do you think about your decision about Livelifetaller?
Let's start from the ending. My decision, I'm happy for my decision, first of all.
Yeah.
And the reason why I choose you, I did a lot of research. I thought I could see you could do this in the US and Germany. You could do it in Germany and a couple of other countries. You could also do it there. When I saw you clinic here, it was like you was like a family here.
Appreciate it.
And I could see that you take care of your patients 100% from the start to the ending. And of course, the center you have. It's the maybe most important thing is the center. Because here in the center, we sit here, all the patients, we watch football games, we play PlayStation every night, we eat together, and we talk every night, we play some games. And if you have some issue with your leg, for example, then you can ask the other guys, did you have the same experience and what did you do? Then they just tell you, do like this and it's over. Then I do like that and it's over. You know, I don't even need to call the nurses. We have nurses here 24 hours. We can call them, the nurses, if something happened. But it wasn't even necessary because you always have one patient who experienced that before. then it's, I did like this, then it's over.
Mentally health, right?
Yeah.
Yeah.
There's always somebody you can talk with here, and it's very important for me. And
You said you did your research. We had also negative comments. What do you think about that?
the negative comments, I can't relate to that. I don't know where they get that from. I never experienced such a things here like that negative. But I know what
Yeah.
I'm thinking about. I also saw it, but I don't know why. I don't know why.
I mean, it's really hard to explain that. Of course, my goal is not to protect here everything, but the best thing what patient can do is like, not for Livelifetaller, also for other clinics, if they are really interested in, just to come, see with their own eyes and visit the place and talk to them and feel confident and not, because internet is a free platform which everybody can give a comment. I can give a comment about you, you can give me a comment about me. But of course, to really know what happened, what's going on, the people should come here or visit the clinic and to see everything with their own eyes. It's the best decision, to be honest.
Because I can't, when I think about it, I can't, I read about and watched some videos, and some people were saying some things, I don't know why they're telling that, but I didn't experience such a things here.
But Erkan, I mean, this is, for example, I also talked yesterday, I guess, with a patient from Swiss. I mean, first of all, none of the companies in the world can make 100% customer satisfied. That's impossible. Even not a Ferrari, even not a Porsche, you know what I mean? Impossible, I mean, because everybody's expectation is different, expectation. But the problem is here, that if a problem happen, especially in our job, for example, we are doing surgery on you. I mean, your health is in our hands in this 3 months, because you trust us, to stay behind of the job and to have solutions, But problems can happen, complications can happen, everything can happen. But the most important thing is to not talk about problems. Okay, we talk about problems, we can talk until tomorrow. But as long as we can fix it, or as long as we have solutions, the problem is not a problem anymore,
And that's why I told you are like a family here. Because even though sometimes I saw maybe a patient did something and it was the patient's fault actually, but your team here, your nurses, security guys, all of them, they act like it was their fault. Even though it's the patient's fault.
I know.
Actually, your team here is, they treat you like you are the king.
Appreciate it. Thank you so much.
They treat you like you are the king, even though if it's your fault you did something. So it's very, you have a very good team here.
I really appreciate it, Erkan. And also, customer is always the king. I always say to my patients, hey, look, nobody's the boss here. Except our patient. Patient is the boss,
You can clearly feel that when you are here.
Appreciate
that you treat us like that.
I really, really appreciate it. Well, thank you for your time, Erkan.
Thank you.
And,
Thank you.
It was a pleasure to meet you. Nice to meet you.
For me also.
Enjoy your height.
Thank
So
you. I
you,
will.
you already make the big
Definitely.
step with the lengthening.
Yeah.
Now it's just small step and to get recovered. And this is something in your hand.
Yeah.
Just keep to do your exercises. That's all.
Of course.
Enjoy your height rest of your life. You choose the way to suffer for 3 months. Okay, it's not really suffer, but yeah, I mean suffer from the comfortable life.
Not for
Yes, but enjoy forever.
Of course, I will.
Rest of
Trust
the
me, I will.
Thank you so much,
Thank you,
Erkan.
thank
Thank you for the great video. Guys, greetings to wonderful Denmark. Thank you for watching our video. See you in the next video. Bye-bye.